truly believe that the reason why so many women wake up in their lives and marriages as they age, feeling completely exhausted, not knowing who they are, feeling like they've lost the chance to become who they were meant to become as little girls. And by the way, this applies to everyone. But the concept of self-silencing first emerged around the disparity between women's and men's mental health. In depression, for example, why do women seem to suffer more? There are lots of theories about this, but one of them is this concept around self-silencing and the role that it plays, because our culture and our gender expectations have told women, just be the chill girl. Be cool, like be a good girl. Be nice, be sweet. This could become an entire conversation about women's expectations that are placed upon us. But I want you to hear me when I say that you have to honor that there are very different expectations, generally speaking, that we place the minute a baby is born on whether or not they are supposed to be certain things. In fact, this just came up. I was watching, if you're not on TikTok, they have these like big things that come up. And they always involve creators and different things. And one of them was a very large family content creator who primarily uses her daughter in content, made a video talking about how she was a boy mom and how, though she was obsessed with her daughter, that her heart and soul belonged to her son. And I have if you know me and this channel and my feelings about that kind of thing, I have a lot of feelings about, number one, using kids as content, and number two, about certainly verbal and public displays. But this isn't about that, though it could be. What made me think about this was like, is that because in part, there are lots of reasons why, but in part you see girls as more difficult to raise? As a mom of 3 sons and a daughter, I think that every child is a gift and every child has their own challenges regardless of gender. But I cannot imagine thinking that way. Like, it's also just not true in my experience. Some kids have difficult temperaments. Some have genetic predispositions. Sometimes life just creates situations where this sensitive child and this trauma don't go well regardless. And there are different concerns for your children as individuals and in terms of their gender. But self-silencing can happen to anyone. So I want to make that clear. It doesn't mean that if you're not identifying as a woman that you don't have this dynamic, but the core of self-silencing is about so much of what I talk about. It's about people-pleasing and compulsive caretaking and suppressing who you are in yourself and identity, most often in intimate, personal, important types of relationships, where you say, you know what, I'm fine. Okay, I'll do that thing. My feelings don't matter. I'll just let it go. I'll be the cool girl and hang out with the guys and have like no needs, or I'll be the best mommy, caretaker, wife, partner, and rotate around everyone else. A lot of this is driven by expectations, like I'm saying, but also our childhoods. I fully believe that childhoods where you had to, for whatever reason, be more mindful of the parents' emotions, regulation, criticism, acceptance, love, caregiving, reciprocity is an attachment, meaning that what is going to get me the most of what I need in terms of being seen and loved and validated and heard, that we are then motivated to do. And so because we don't want to feel rejected or less than or unheard, we are wired since birth to sacrifice those needs of identity in service of getting our literal, physical, and emotional, if possible, needs met. A child has no option. If, as I talk a lot about in disorganized attachment, where the source of safety is also the source of fear, the child will choose the source of safety. Now, it's not actually safe with parents who are mentally, physically, emotionally unpredictable, unsafe, but you have to choose that. You cannot choose anything else. Your job is to survive. That is your only job as a child. And that often comes at the cost of development. We know that having traumas and developmental dynamics interfere with the natural progression of identity and who we are, that we learn to, in each of our own childhoods, give back what is needed. So we know that, for example, self-silencing can lead to a lifetime of mental and physical illness, chronic illness, illnesses like cancer, heart disease, chronic fatigue, IBS, all kinds of risk factors around chronic illness and functioning, including PMDD. All kinds of dynamics have been found to be related to it, not to mention the incredible amount of mental health issues, certainly depression, anxiety, risk of finding yourself in potentially unsafe relationships, finding you have a fear of abandonment, and so you maintain that facade of people pleasing and compulsive caretaking. And we know that when we do that, if I only focus on your needs and you, I am therefore neglecting often my own. I'm numbing and minimizing my own. I talk a lot about in anxious attachment, the idea of that outside-in orientation, because the parents are chronically inconsistent, unpredictable. We learn to oftentimes be hyper-focused on what they need because we know that that's going to determine what we get. And so we often look to the outside first. Are you okay? And can I give you what you need, or you're what matters most, to then determine if I'm okay? That outside-in orientation is the core dynamic of people-pleasing and compulsive caretaking, both of which are very common, where the parent's mood and mind spill over more and more into the child's world when we look at more anxious and or disorganized or fearful attachment types of attachment patterns. So what do the signs look like? Number one, a chronic feeling of worthlessness. Deep inside, you feel unworthy, unlovable. Number two, feeling like it is your job to take care of everyone else, and over the course of that, often sacrificing your own needs and not knowing what they are. Number three, having significant issues around identity, not really knowing who you are, what really matters to you, having strong opinions, making decisions from a sense of self. So there's a chronic identity issue oftentimes. And or the next one is the way you are in the world is in response to being perceived with an identity of being something like selfish, narcissistic, self-focused. You almost build your sense of self around the opposite. You create and construct a very compliant, easy, caretaking, nurturing person, and you may be all those things. But also, you might have dreams or anger or fears or resentments or desires or needs that you suppress. The next one is mostly putting everyone else's needs above your own and never even thinking about, not just neglecting, but not even knowing what your needs are, as I've said. Another sign is learning to visualize and create a mask of I'm fine, like becoming a master at that, where you present to the world a very physical, different image of who you really are, and you actively feel a lot beneath the surface, but you've learned to not show it. Finding it hard to be whatever you think could be your authentic self, so you curate a version that you act like is vulnerability and authenticity, but it's actually on your terms, right? If that makes sense. So you think you're being a certain way, but you're really blocking off a lot of parts of who you are, and you curate and present what you think is yourself. But in reality, there's a lot more to the story. Avoiding conflict, not speaking up, walking on eggshells around other people because you don't want to even get close to upsetting them, being in trouble, being rejected, not being liked. So you're a high scanner in terms of hypervigilance, right? Your job is to be very aware of others to make sure that you're not at fault. Now, the reality is you often feel like, though you don't express it, that you are in trouble, that they don't like you, that it is your fault. But you're more focused on trying to prevent that, even though you feel it often anyway. Maybe not knowing how you really feel, having a hard time connecting to emotions, especially negative ones like anger, frustration, resentment, sadness even. But at the core, often just not really being sure how you feel about things because you've been cultivating this response to others. Feeling like it's your job when someone has big feelings to take care of their feelings, to make them feel better, to make them happy, to cheer them up, and or once again, like whatever they feel, it's somehow your fault. And the last one is being really more motivated by what other people think about you than what you think about you. And so your whole presentation to the world is driven by being presentable, easy, pleasing, caregiving, like I'm saying. And the cost is your own sense of self and identity. So we'll talk more about this, but I think it's important to understand that all of this is a constant suppressing of your emotions, of your responses in your brain. And we know that all those chronic exposures, those little t traumas to relationships and sense of self and walking on eggshells, that they have a significant impact on our body. And so you might have a lot of those things like chronic illness, IBS, chronic fatigue, autoimmune disease, diabetes, all kinds of issues that also might be connected to your, not just your chronic stress response, but to illness, to lack of self-care, things like that, what you eat, if you exercise, like your whole thing is really more about not providing for yourself, and there are consequences. So, of course, you would want to look at in a therapy situation or research, where did I learn this? Of course, we know, like I'm saying, the culture, especially here, I would say all over the world, really for women, is there are very specific things about what it means to be a woman. And every culture has some tweaks on that, some more severe than others, but to examine what was I taught to believe in the larger environment, in the culture, in the system, in the society, in my own family system. We know in certain environments like religion, for example, there's a very strong hierarchy, especially about women's, how big they can get, what roles they can have. And I'm not challenging your beliefs, but it's important to look at what was the message and how might that have impacted who I am. Honoring your feelings, doing work on identifying what you really feel, especially around anger and resentment. Looking at your compulsive caretaking behaviors. What does that look like? I have videos on that here too you can check out. Looking at your boundaries or not. How much do you disregard boundaries in the service of pleasing others? Working towards identifying and prioritizing your own needs and desires. It doesn't make you selfish to also have needs as much as you care about other people too, right? But you might not even know what those are. Working on how you deal with self-advocacy, which directly connects to what often looks like what you think is confrontation and anger, but understanding that self-advocacy is not the same thing as conflict, but there is something to be said for learning how to advocate. And if it leads to conflict and therefore leads to anger, to being able to engage in that without avoiding it, that gives yourself a space to have a voice. And certainly working on all the factors like shame that affect worthiness. And as I've talked about, and we'll be sharing more in my course too on hypervigilance and childhood relational hypervigilance and interpersonal hypervigilance and trauma, is that when you've learned, especially in the culture and society and your home, that other people's needs and feelings matter more than your own and or dictate your safety, which are both true in the culture and eggshells, right? Walking on eggshells, you have to sacrifice often a large part of who you are. And the safety piece is a very real thing that women face every single day, that we learn. I'll give you a quick example. I had a client say to me once years ago, like I had a date or something, and like I don't know why she just couldn't say what she thought or didn't whatever. And I said, you understand that for many of us, That's dangerous. Meeting some person you've never met before and expressing what you really feel, especially if it could be perceived as rejection, could be, not necessarily, but could be dangerous for us. So again and again and again, we've learned that we have to assess when we can even consider speaking our minds. And though that can be true for anyone, it is especially true, I believe, for women. So, like I said, this can apply to anyone. I would argue if you've had a childhood where you had to walk on eggshells, just that alone, you've probably learned a lot about rotating around others, avoiding conflict, and self-silencing in many ways, regardless of who you are. It's about you having to suppress your real self in the service of attachment and survival. And that often plays out not just in childhood, but in your adult life. So, hope this was helpful. Thank you for being here. Please stay safe and well, and I'll see you soon.